Welcome to Focus on Health, where we enlighten you on matters health. My name is Boari Michelle. Cancer Awareness Day is celebrated every year on the 4th of February. And today we are going to be enlightening you on a cancer overview and narrow down to cervical cancer. But even before we see Daktari on that, here now is the fact of the matter. Quite informative. With me on set is Daktari from Bliss Medical Center, and you're going to be talking about cancer and cervical cancer. Welcome, Daktari, to Focus on Health. So, Daktari, the theme of the Cancer Awareness Day is I am and I will. So basically, we have to make positive impacts to reduce cancer. But even before we head on to that, Daktari, maybe you could introduce yourself to our viewers.
My name is Dr. John Macharia. I work for Bliss Medical Center.
Okay, thank you very much, Daktari. Daktari, maybe you could head down to what exactly is this Cancer Awareness Day?
Cancer Awareness Day is basically, just as the name goes by, it's just a day to be aware of cancer. Now that cancer has become a major problem in our society. So it's a day that makes the population aware that cancer exists and ways to prevent it.
Why is it important to create this awareness in our society?
When we say that information is power, and the only way we can prevent and manage this cancer is by knowing that it exists. So awareness is the first part of management of cancer.
Okay.
Yes.
Daktari, even as the citizens, as the society, the family to friends, people suffering from cancer, how can we, maybe make steps in order to ensure that, they feel at home, they feel safe, and awareness is created all around?
Well, you see, when you have the information, then you will know that the information will include screening of some of these cancers, early detection of some of these cancers, knowing how to manage these cancers. So with the information, then it is way easier to be able to manage these cancers because you know the treatment modalities, you know the preventive measures, you know the screening measures. So basically, it all starts with awareness.
Okay.
Yes.
So Dr. maybe we could now head down to what exactly is cancer?
Cancer is a situation whereby in the body, the cells of the body keep on multiplying and dying. They have a lifespan. They multiply, some are created, others go dead, or the old ones die. So there is that kind of check and balance, that some cells will die, others will be formed, others will die, others will be formed. So when this mechanism fails, is where you have overproduction of these cells, with less of them dying. So you have what we call overpopulation of these cells, or what we can say growth of these cells. So it is that check and balance that is distorted in form of, in cases of cancer.
Okay.
Yes.
And is there a particular cause to cancer, because it's still a mystery in our society?
Well, there are different. Okay, we cannot just say as a blanket that there is this causes this cancer. It depends. Different cancers have different causes or cofactors or risk factors. So you will find that the risk factor of cancer of the lung could be smoking.
Okay.
But that does not mean that smoking will also be a risk factor for another cancer. So it depends on which cancer you're talking about.
Okay.
Talk about cervical cancer, it's associated with a virus, human papilloma virus, but the human papilloma virus cannot cause cancer elsewhere, let's say, for example, cancer of the skin or something of the sort. So different cancers will have different causative agents or risk factors. Yes.
Okay, you've actually taken me to my next question. What types of cancers do we have?
Well, cancer can affect any part of the body. We'll have cancers of the skin, we'll have cancers of the muscle.
Okay.
Yeah, but you have skin cancers, which are different types of them. You have Cancers, any organ of the body, any tissue of the body can be cancerous.
Okay.
Even the bone can get cancer. The brain can get cancer. The tongue can get cancer. So any part of the body can get cancer.
And do we have maybe common signs and symptoms that maybe they can just be general? Maybe it's not like specific to lung cancer, but just general, symptoms that would make you know, hey, you should actually go get screened for cancer.
Well, like as I said before, different cancers will have different signs. If you're having cancer of the lung, difficultly you might present with difficulty in breathing. And like if you have cancer of the skin, so you see, if you have a cancer of the skin, you can have a very big ulcer that is not healing. So different cancers will present differently depending on the organ affected. Yes.
And is cancer genetic? Can it run, run down through a family history?
Yes, there are some cancers that are known to be genetic. Breast cancer has a genetic connotation. Yeah? Breast cancer is known to be genetically passed on. So if you have a first relative or a twin who has breast cancer, then you should be very vigilant in screening for breast cancer, because the chances of getting breast cancer are quite high. So there's a genetic predisposition. Yes.
And when,
So are even other cancers like cancer, like leukemias also. They also have some genetic predisposition. Yes.
And when it comes to age, do we have a particular age group that is more prone to cancer? Can we have even babies maybe being born with cancer?
Yeah, we have cancers of the newborn. They're not, or the newborn, which is not very common, and they are not very many. These are cancers. With some of them we call it nephroblastoma or retinoblastoma. Retinoblastoma is one affecting the eye. Nephroblastoma affecting the kidneys. Those ones you get them in the early age. Yeah, maybe before 10 years, around between newborn up to 12 years. But majority of the cancers we discover chances of cancer increase with the age. Yes. So as you grow older, the chances of getting cancer are also higher. But that does not mean that you cannot get cancer at a younger age group. But you get majority of the cancers are at older age groups, over 30 years and above. Yes.
Dr. Is there a chance of one actually getting cured from cancer?
Well, very good question. Most cancers actually, there are some that are, depends on the cancer you're talking about. But you discover that most cancers, when detected early, are curable. But I'm not saying all of them. I mean, I can give example like breast cancer, early breast cancer, gotten early is curable. Cervical cancer, gotten early is curable. So some of this, it depends on the cancer itself. But like cervical cancer at early stage is 100% curable.
Okay.
Colon cancer, for that matter, detected early is 100% curable. So basically, when you look at it, I think when it comes to cancer, it's the time of detection. So that is when screening becomes also important. Because you detect it early, then chances of cure are higher, or prolonging life is also higher if you get it early, because you're going to take the necessary measures early enough. Yeah.
Okay, so Dr. Now that the cure is not, like 100%, and also it's silent, so you can't really tell whether you have cancer or not, is there anything we can do maybe to prevent the cancer?
One, we have the risk factors. You discover that for different cancers, if the risk factors, smoking, alcohol consumption, those are risk factors, and also depending on the cancer, like if it is breast cancer, also looking at genetically, that is there genetically, then screening also will also assist. So mainstay is screening for these cancers, and then avoiding the risk factors of these different cancers. Yes.
Dr. Maybe you could take us through the different treatment methods that you have for cancer and how effective they are.
Well, different cancers will have different treatment modalities. But modalities for treatment of cancer range from surgery, radiation, chemotherapy, and all these radiation, chemotherapy, we call them palliative also, or adjuvant. We call them adjuvant. They are added. They can be surgery alone, or surgery with adjuvant therapy. In adjuvant therapy, it could be chemoradiation, or chemotherapy alone, or radiation alone. Yes.
Okay, and in this maybe particular treatment methods that you have, is there like maybe drugs that one gets, to take on the side?
The drugs, chemotherapy is drugs.
Oh, okay.
Yes, chemotherapy is drugs. It's a form of drugs, basically. Radiation, radiotherapy is where you use radiation to hit the cancer cells. So the drugs we're talking about here are basically those chemotherapy drugs, but also we have other drugs that also are the chemotherapeutic drugs. Yeah, in case of cancer, they are saying some of them are hormonal, depending on the cancer. Yeah, like breast cancer, you can have some medicine that are hormonal as part of the treatment. So those are drugs that, and also in case of pain, because sometimes in case of advanced cancer, you're basically just doing palliative care, and that's where strong painkillers like morphine, controlled use of morphine and pethidine, all these painkillers and blood to improve just the quality of life are indicated. So it's a whole cocktail.
Okay, Dr. maybe you could hold on to that thought. We are going to take a slight commercial break, and when we come back, Dr. is going to be telling us about cervical cancer. Do not move a muscle. I will leave you with the Did You Know segment.